straight year and remained in the top spot in the 2021 Diversity Inc. rankings for hospitals and health systems. Northwell is also recognized in 4 other Diversity Inc. specialty lists. These ranks are a reflection of Northwell Health's decade-long journey toward the tenets of diversity, inclusion, and health equity for its team members, patients, and communities. Further, and in partnership with the Healthcare Anchor Network, Northwell is one of the first health systems to declare racism as a public health crisis. This leadership accountability, exemplified at Northwell Health by CEO Michael Dowling, is foundational to achieving and maintaining health equity. Diversity Inc. celebrates with Northwell Health as Dr. Mieres, McCulloch, and Wright publish Reigniting the Human Connection, a pathway to diversity, inclusion, and health equity, to provide best-in-class strategies to ensure sustainable equity, diversity, and inclusion outcomes for diverse workforces, patients, and communities. Carolyn Johnson, CEO, Diversity Inc. Reigniting the Human Connection amplifies the major lessons from COVID-19 in addressing health equity with communities of color disproportionately impacted. It is an urgent call to action for the U.S. healthcare system. Rohini Anand, Ph.D., CEO, Rohini Anand LLC, former Global Senior Vice President, Corporate Responsibility and Global Chief Diversity Officer, Sodexo, author, Leading Global Diversity, Equity, and Inclusion, a guide for systemic change in multinational organizations. We're approaching an inflection point in healthcare, and we can no longer afford to embrace a partial commitment to accessibility, quality, and equity in an increasingly complex and ever-changing healthcare environment. This book not only lays the groundwork for a transformation in how we think about advancing health equity, but will also serve as an essential and practical tool for healthcare change agents. Reigniting the Human Connection, the pathway to diversity, inclusion, and health equity, is the most important book written on the biggest challenge confronting healthcare leaders and providers. Daniel E. Dawes, J.D., Executive Director, Satcher Health Leadership Institute, Morehouse School of Medicine. Author, The Political Determinants of Health. This book captures the critically important work of advancing diversity, equity, and inclusion in healthcare, and lays a foundation for other health systems and caregivers who follow this path. As a cardiologist focused on sex and gender-based cardiology, and who has led efforts to advance diversity, equity, and inclusion, I know that those health systems that embrace these changes will benefit the communities they serve, their people, and their patients. Congratulations to Dr. Mieres and colleagues on leading the way for so many others. Pamela S. Douglas, M.D., M.A.C.C. Ursula Geller Professor of Research in Cardiovascular Diseases, Department of Medicine, Duke University, Director of the Multimodality Imaging Program, Duke Clinical Research Institute. In Reigniting the Human Connection, the authors, whom I've had the pleasure of knowing and working with over the years, provide a thoughtful, timely, and much-needed assessment of healthcare, centering diversity, equity, and inclusion in ways that demonstrate this work is a need to do, not a nice to do in today's world. Comprehensive, evidence-based, and built on real-world experience, this is a must-read for those in this work now and interested in this work in the future. Joseph R. Betancourt, M.D., M.Ph., Senior Vice President, Equity and Community Health, founder, the Disparity Solutions Center, Massachusetts, General Hospital. At the beginning of this important and insightful book, the authors explain their bold mission to ask difficult questions about health disparities and the way we approach healthcare in this country. Readers will be inspired by their honest approach in seeking answers, and also by their insistence that